Empowering families and protection of children requires a holistic approach. But to achieve it fully, the unprivileged people need not to be left behind. Advocacy Center for Child and Family Safety and Protection, ADSupp, implements various programs that aim at addressing this problem.
My name is Lumbert Kaliba, and I'm the Executive Director of Advocacy Center for Child and Family Safety and Protection. Well, AdSupp was started in 2015. That's when this whole idea to start this organization was hatched. We started AdSupp to protect our children, protect and safeguard our families. We have our education program where we support children in school through giving them scholastic materials, fees, and a lot of things like counseling and many others. Then we also have our livelihood program, which is doing very, very well, by the way, and this has helped us to keep our families together. We also have our health program, whereby we partner with government to extend the services to our people. Other key program, that is Advocacy for Child and Family Protection. And here we focus on child trafficking.
Through its programs of education support, financial literacy and livelihood empowerment, primary healthcare and nutrition, ADCSAP Uganda helps in supporting poor rural people in Toro region.
For this year, under our education program, we are supporting over 100 students in primary and secondary school. These children from the poorest households, these parents who cannot support these children to go to school and pay the school fees, and also offer them with scholastic material. So offer them with scholastic material, give them the school fees, and of course keep supporting and monitoring them at school to see how they are doing. And we hope to do this again next year because there are more that are down there.
Acknowledging the value of education, children are supported with school fees and other scholastic materials.
Nkaba nyina challenge ya fees niyo yampambirize kugenda mu rukuratu. Agwirobu kabambaranga yine muno mu byantasya. Nubo bwire nkaba ntatya tunga kasento kona. Bansazire hamsara abwensonga kandi hatekyo nahurire besero rukuratu nanye nagenda kwankanye no gwetabu ndio bunahikireyo akobo mwana wange akana qualifying he was considered for a bursary.
Tongole kya Kaliba Lumbert chikanyamba muno habo budune bwango banagenzere ningamba yo kabandu kubi muno omwana wange akakora kya musanzu ihayo omusanzu uberehera musanzu nagamba omwana ono muteke nkaha tinchine sente zo kuherera abana nyo hatwikara umwana amazikora kurungi ngamba umwana ningenda kumuteka nka ndubonyeruka ngenda mukitongenda mpura haredi hano baranga ngukaliba nanka kaliba nakora kinayamba abana nyiruka ngenda mutawuni mpaka naka mwakaliba henyene kaliba nsindika ofisi nsanga yatenyo gonaka Lumbert nasangire Lumbert ngamba nawo mugambire bizu byange byona mugamba nyowe abana mwana wange akozere kurungi ehera yo musanzu cyonko tukwesobora nko kutuli atenye nawe atanagirize yemba umwana oguya mutwara.
Nimbaza kusima ekitongole kya AdSupp habo kunkwataraho kuherera omwana wange ayebale besi bakata kumusomesa ali mu senior 1 up to senior 6 now kandi nakora kimkurungi muno.
This support not only helps to ensure children have a good future to participate meaningfully to nation building, but also relieve their families from poverty.
Nzanokuhea ngana ente buli memba mukantu mugurente umusaija kandi omukazi ntumugurire embuzi ekitebe cyaitu kenu keba cyo omukazi no omusaija tukatwara omukazi no omusaija omukazi tumuhe embuzi omusaija tumuhe ente.
Now for our livelihood program, because we look at most of these challenges, education challenges, advocacy challenges, we look at health challenges happening because families cannot support themselves better. So we are now trying to support the economic activities of the parents by forming VSLS. So we have VSLS that we have formed against apiary, this is beekeeping. We have formed VSLS against fish farming, we have also formed VSLS against craft works. So we've moved forward to that. And starting with last year, we also now started forming VSLS around goat farming. So these households can, at least each household can have a goat that can be able to produce more and provide income for these households so they can be able to boost ourselves. So if you look at the Chenjejo Goat Project, those people who started with 10, they have over 40 goats and they are moving forward. Now they are looking at going into chicken and others, and we shall keep supporting them so they can have an income.
These efforts are aimed at the building of financial sustainability of families. However, cognizant that self-sustainability requires knowledge, ADSupp also conducts financial literacy and initiates saving schemes for group members.
Yeah, AdSupp Uganda has also helped us to get ourselves into a saving association. That saving association has helped us also to acquire some loans, little loans, which we have also used to, personally I've used it to invest it in some self-sustaining projects.
Chairperson wa Buhes Saving and Credit Association, tuli ba member 30, tusoboire kwahura milioni 5.20 omwaka gumu. Obusente ezo ntuziha mu bintu byete byengaro bino ebyokurora ebya handicraft, abakazi nibaruka nibasevinga kandi sente zino zitukonyire kutunga akaloni. Buli mukazi naye kurakuraniza mukaye, abandi batungire enkoko, embuzi, ente n'endime y'omulembe.
To ensure health population, ADSupp's primary healthcare and nutrition program provides health services to protect beneficiaries from diseases such as malaria that could affect their productivity. They give out mosquito nets in addition to sensitization activities and diagnosis which are done during village health clinics.
So we decide to partner with the health centers and mostly government health centers to bring health facilities here. So we brought the nurses around to do checkups of the people around. We also brought the medication for the unsuspected diseases within the villages. So immediately after testing, we do the prescription and these people get the medication. Additionally, we have also come with mosquito nets, which are also provided by the health facilities and provided them to the people. We know this place is mostly infested with mosquitoes and it could really cause a lot of malaria and bring a lot of problems to the young mothers and the little children. For pregnant mothers, we know they will also have challenges getting facilities. So we also gave them mama kits, and these ones will help them at their birth.
Kandi kintu kimfokire kichaka muno mu kichweka cyange kene abokorora ibintu bikusana biti kandi ubujanja byo bukwingana hano ekinsemize muno
ni mpura nyino muhimbo mwingi nyino kusemererwa kwingi neno emyaka yange mbe twarugire nyuma ntubona hati tutungira obusinge nibo tusanga maka nibusanga tuikalire nsemerirwa muno.
In every intervention there are some challenges faced. ADSupp faces challenges too.
Quite a number of challenges, though some of them are beyond our control, like the road networks, the places where we work, it's really tough. And with our low car, not motorized, we always find it so hard to really maneuver around. And when you go into rentals, it becomes so expensive, eating into our planned monies for the programs. And then also second, like for the health programs, the numbers are overwhelming. You find there are many people needing support, but now even the government medication sometimes is not enough. Even what we offer is not enough. So we've tried now to partner with other agencies, but we find it's really overwhelming. Maybe with more funding, we can see increasing on funding for these health programs and boost it much better. For the education program, we've tried to really recruit, even if the number is too huge. We have had a problem with sustainability because we support the child from primary up to secondary, but after secondary, there is no future ahead.
Actually, for the last 3 years, we've had budget deficits, and we are trying to do more fundraising to see that we fund our budget. When you plan and you don't implement because of resources, it really pains a lot. And seeing our people there suffering, families breaking down, it really pains us a lot. And we are trying to fundraise to see that we reach a number of more communities that are not yet benefiting from our programs. My last remarks, I would say that thank our partners, people who have supported our work, people, our colleagues in South Africa, our partners in the US, our partners around Fort Portal, in Uganda. People have donated their monies, and we don't want to just take it for granted. We are so much honored to have the people out there support our work and realize that we are changing lives in the region.
Despite the challenges they face, interventions by ADCSAP have helped improve livelihoods, access to health services, access to education and protection of children. And beneficiaries now have a reason to hope for a better future.